narrow. This dotted line is divided into the larger lateral area and a smaller medial area. This medial area again divided into a narrow strip. This is number 4, and we give the number for the articulation to confirm the articulation when which part is articulate with the femur. So number 4 is articulate with the femur when full flexion of the knee joint occur, and these two part again divided into 3 area by 2 vertical line. That number 3, 2, and 1. These are same. 3, 3, same. 2, this whole part is called 1. So number 3 is articulate with the femur when mid flexion occur. And number 2, articulate with the femur when slight flexion occur. Number 1, this portion is articulate with the femur when extension of the knee joint occur. Okay. So in the patella, the important question is which type of bone it is and the characteristic features of this bone and the attachment of this muscle. And these 4 muscles together called quadriceps femoris. The tibia. Now, we already tell the tibia, so we not tell tibia now. We go into the fibula. Fibula. Fibula is also a morphologically which type of bone it is? It is typical long bone. Together, this figure is together with the tibia. This narrow bones is the fibula. So tibia and fibula is the bones of our leg. Tibia lies medially and the fibula lies laterally. So fibula is homologous as ulna. So it is lies laterally, so homologous as radius in the superior extremity. This is the fibula. It is the typical long bone. So it has upper end, lower end, and the shaft. Upper end is called the head of the fibula, and there is a projection is called the styloid process. Head and the styloid process, and this narrow constriction part is called the neck, and this lower below this neck, this whole part is the shaft, and this one is the lower end. Lower end has a projection is called the lateral malleolus. In the tibia we read the medial malleolus, but in the fibula we tell the lateral malleolus because it lies laterally. So upper end is expanded in all direction, and styloid process lies posterolaterally. Then the shaft and the lateral malleolus lies posterolaterally. Malleolar fossa faces medially. Malleolar fossa means this is the malleolus, lateral malleolus. Here is a depression. It's called the malleolar fossa. In the lower end, this one is the anterior surface and this one is the posterior surface. The anterior surface has rounded. The posterior surface, there is the groove for passing the tendon, and the lateral surface is smooth, and the medial surface has upper triangular articular part. It articulates with the bones of talus in the articulated foot, and there is a lower area, there is a depression, it's called the malleolar fossa. So you see the figure, this one is the fibula, this one is the head, then the neck, then the shaft, and then the lower end. And the same in the posterior view, the head in this projection is called the styloid process. This one is the neck, then the shaft, and the lateral malleolus. In the shaft, there is a 3 border. The anterior border, when you hold in anatomical position, we hold the lateral malleolus by this way. So lateral malleolus lies posterior medially and fibular facet faces medially. So this one is the anterior border. Just behind this one is the posterior border and the medial border. The anterior border, posterior border, and the medial border. So the surface are the anterior surface, posterior surface, and the lateral surface. And the posterior surface is the more larger surface, and posterior surface again divided by a vertical ridge or a medial crest in the medial part and the lateral part. Okay, in these bones is very important is the relation of the neck of the fibula. There is relation with the common peroneal nerve. Common peroneal nerve is the a branch of the sciatic nerve. Important nerve of the lower limb is the sciatic nerve. It comes from the greater sciatic foramen. We read the hip bone, the greater sciatic foramen. From the greater sciatic foramen, the sciatic nerve, it come into the popliteal fossa, in the superior angle of the popliteal fossa, then it is divided into the common peroneal nerve and the tibial nerve. The common peroneal nerve is related with the neck of the fibula. And then it again divided into two, the common peroneal nerve to the deep peroneal nerve and the superficial peroneal nerve. If any injury or fracture occur in the neck of the fibula, the common peroneal nerve is injured. If the common peroneal nerve injured, the foot drop occur. We read in the super extremity that the wrist drop. If radial nerve injury occur, then wrist drop occur. And if the common peroneal nerve injury occur, then the foot drop occur. Okay. So why the foot drop occur? Because deep peroneal nerve supply the anterior compartment of the leg muscle. So if the deep peroneal nerve injury occur, then the paralysis of the anterior compartment of the leg muscle and the in foot we tell that dorsiflexion and the plantar flexion. So this movement is not possible. This dorsiflexion is not possible. So foot drop is occur. Then you see this figure, tibia and fibula together, the muscle attachment. But in the fibula, I don't now not tell the attachment of the fibula because you read in the tutorial class the attachment of the fibula. Now we go into the articulated foot. Okay, so this one is the articulated foot, like the articulated hand. These all are the tarsal bone. In the hand, we did the carpal bone. So tarsal bones lies proximally, and the first metatarsal bone. See the first metatarsal, it is strong and short, and it lies medially. And the concavity of the plantar surface is directed downwards. So you hold these bones by this way. These all are called the tarsal bone. In the tarsal, the name are calcaneus, then talus, then navicular and cuboid. Three cuneiform. These three are the cuneiform. These are the metatarsal and these are the phalanges. And now you see the figure. This one is the talus, then calcaneus, navicular, cuboid, three cuneiform, and the cuboid. And these all are the metatarsal, these all are the phalanges. Same as the articulated hand. So tarsal bone, all are the tarsal bone are which type of bones they are? They are the short bone. Metatarsal bone are the miniature long bone. And the phalanges are same miniature long bone. In the first metatarsal, there are two phalanges, proximal and distal, but the other metatarsal by other finger, there are the three phalanges, proximal, middle, and the distal. Okay, now we go into the joint. Okay. So first first joint in the inferior extremity is the hip joint. How it is formed? It is formed by the acetabulum of the hip bone and by the head of the femur, like this way. Can you see?
Yes,
Hello?
ma'am.
Yes, ma'am.
Yes, ma'am.
So it is formed by the acetabulum of the hip bone and the head of the femur, and this from the hip joint. Hip joint is very important, and it is the large. It is a large joint. It is ball and socket type of synovial joint. Okay, so you read this part, the articular surface and the type, ball and socket type of synovial joint and the articular part. In the acetabulum, there is the acetabular notch, there is a gap. So it is filled up by the transverse ligament, and in the central portion of the acetabulum, there is a acetabulum fossa. And the articular part is covered by the hyaline cartilage, and this border of the acetabulum is covered by the acetabular labrum. Acetabular labrum is a fibrocartilage. So it stable the hip joint. These all are the articular part. The hip joint is unique and having a high degree of stability as well as mobility. In the hip joint, the movement is smooth. All type of movement is occur here: flexion, extension, abduction, adduction, medial rotation, lateral rotation, and also the circumflexion. This is the figure of hip joint. This one is the acetabulum. This one is the head of the femur, and this is the acetabular labrum. This is the acetabulum. Only show the acetabulum. This part is the articular part, and this is the acetabular fossa. This one is the acetabular notch, which covered by the transverse acetabular ligament. The hip joint is stability depends on some factor. You must memorize this factor: the depth of the acetabulum and narrowing of its mouth by the acetabular labrum, tension and strength of the ligament, strength of the surrounding muscle, length and obliquity of the neck of the femur, atmospheric pressure. All are the factors for stability of the hip joint. And more ligament present in the hip joint. More ligament, they are the first, you tell the capsular ligament, the iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, ligament of the head, and transverse acetabular ligament. You must remember some name of the ligament of the hip joint, because hip joint is very, very important. The iliofemoral ligament, when we read the femur in the intertrochanteric line, we read this attachment, intertrochanteric line in the upper part, the upper band of the iliofemoral ligament, and the lower band of the iliofemoral ligament, the lower part of the intertrochanteric line, and the Y-shaped band into the acetabulum. So it's situated in the anterior surface of the capsule. It prevents the hyperextension of during the standing. So you must remember the name and the attachment. The main function is not important for you. So you must read the name and the attachment. Pubofemoral, it means it attaches the femur and the pubis. Ischiofemoral, same, the ischium and the pubis. And the ligament of the head, like we read the ligamentum teres, the fovea, head of the fovea, that is the ligament of the teres, and transverse acetabular ligament in the acetabular notch. Just see the figure. This red color mark is the iliofemoral ligament. So iliofemoral ligament in the femur, the upper band and lower band, and the ilium is the iliofemoral ligament. This green color is the pubofemoral in the pubis and the femur. And this is the posterior part, posterior surface view. So this one is the hip bone ischium, and this one is the neck of the femur in the intertrochanteric case, near the intertrochanteric case. This one is the ischiofemoral ligament. The artery supply of the blood supply of the hip joint. We already read in the femur that the head of the femur is supplied by the reticular artery, which comes from the trochanteric anastomosis, and also the medial circumflex femoral artery. Medial circumflex femoral artery is supplied the hip joint. It is important because the intercapsular part and extracapsular part blood supply are different. If any injury occur, common fracture of the femur in the neck of the femur. Neck of the femur is the common fracture site. If fracture here occur, so the head is not get the nutrition supply. So avascular necrosis of the head of the femur occur. It is a important clinical condition. You see the figure. This one is the artery supply of the head. This one is the branches of the obturator artery, lateral circumflex femoral artery, medial circumflex femoral artery. This head, we tell that the intracapsular and the extracapsular part. In the neck, there is the anterior surface, the intertrochanteric line. Up to intertrochanteric line is the intracapsular, but in the posterior surface, the half of the neck, It means medial half and lateral half. Medial half is the intercapsular and lateral half is the extracapsular. Commonly fracture occur in the middle of the neck, so the head not get the nutrition. There is the movement. It is very important. Hip joint, like a shoulder joint. So flexion, extension. What are the chief muscle? You must memorize the chief muscle. Flexion occur by the psoas major and iliacus. Extension occur gluteus maximus and hamstring muscle. Adduction occur adductor longus, adductor magnus, and adductor brevis. Abduction occur gluteus medius and minimus. Medial rotation by the anterior fiber of the gluteus medius and the minimus. Lateral rotation occur by the two obturator, two gemelli, and the quadriceps femoris. You must remember the chief muscle first. The clinical condition of the hip joint. If any congenital dislocation, sometimes some congenital dislocation, congenital means during after birth we see that is a dislocation in the hip joint. This is called the congenital. So it is commonly hip joint. It is more than the other joint common in the hip joint. The head of the femur slip upwards on the gluteal surface of the ilium because the upper margin of the acetabulum is developmentally deficient. যদি এই acetabulum, this acetabulum of the upper margin is deficient, then the femur head slip upwards and this dislocation occur. So it is called the congenital dislocation. There is another important is the coxa vara and coxa valga. What is coxa vara and coxa valga? In the femur, we read that angle between the upper end, it means neck and the shaft. There is an angle is 125. It in the range it is 120 to 135 is normal. It is the angle in between the neck. This one in between the neck and the shaft. There is the angle. This angle is 120 to 135 in normal. But if it is less than 120, just see this one, less than 120, it is called the coxa vara, and it is more than 135, it is called the coxa valga. So it causes deformity in working. We not work normally if this degree of this angle is up or down. It means coxa vara or coxa valga. Knee joint is very in the inferior extremity. Knee joint and hip joint is very important. You read details from these two joints, but other joint you only read the types of the joint and only the movement. But knee joint and hip joint you read details, also the ligaments. So in the knee joint, it is the largest, most complex joint of the body. The complexity of is the result of fusion of three joints. So we tell the joint type according to simple, compound, and complex. If two bones joined together is called the simple, but more than two is called the compound. And if more ligament, meniscus is surrounds the joint, is called the complex. So knee joint is called the complex variety of joint. As two joints occur in between the femur and tibia, there are the condylar type of synovial joint. Because the condyle of the femur and condyle of the tibia from this joint, this is the condylar type of synovial joint, and the femur and the patella, femoropatellar joint, it is the saddle type of synovial joint. You see the figure, this one is the femur, condyle of the femur, this one is the condyle of the tibia, and this one is the patella. And these all are this crossing, this is the cruciate ligament, and this is the medial lateral meniscus, and this one is the medial meniscus. Already I tell of that things. The compound synovial joint incorporating the two condylar joint between the condyle of the femur and the tibia, one saddle joint between the femur and the patella. The articular surface of the knee joint. The condyle of the femur, the patella, the condyle of the tibia. The femoral condyle articulate with the tibial condyle below and behind and with the patella in front. The ligaments, the extracapsular ligament and the intercapsular ligament. The extracapsular ligaments are the fibrous capsule, the ligamentum patelli, medial collateral ligament, lateral collateral ligament, oblique popliteal ligament, and the arcuate ligament. And the intercapsular, the anterior cruciate ligament, posterior cruciate ligament, and the medial meniscus and the lateral meniscus. We read this medial meniscus, lateral meniscus in the tibia. In the tibia, the upper surface, upper end, it has the medial condyle, lateral condyle. These are attached with the medial meniscus and the lateral meniscus. And cruciate ligament we read in the femur and also the tibia. Some movement occur in the knee joint. These are the flexion, extension, medial rotation, and lateral rotation. What are the muscles? And they are also causes the locking and unlocking of the knee joint. So when flexion occur, first unlock and the extension occur. And when extension occur, there is the locking. When extension to flexion occur, first unlock, then flexion occur. So the flexion muscle are the biceps femoris, semitendinosus, semimembranosus, gracilis, sartorius, and popliteus. Flexion is limited by the contraction of the back of the leg with the thigh. Extension by the quadriceps femoris. Extension of the knee joint by the quadriceps femoris. The quadriceps femoris muscles, all 4 muscles together called the quadriceps femoris. The muscles are sartorius, vastus medialis, vastus lateralis, and vastus intermedius. And the medial rotation occur by the sartorius, gracilis, and the semitendinosus. Lateral rotation by the biceps femoris. Can you understand?
Yes, ma'am.
Okay, these all are the movement of which joint?
Knee joint.
Knee joint, yes. So when we stand, then the knee joint is extension. And when we sit, the knee joint is flexion. This one is the locking and unlocking. Locking is the mechanism that allows the knee to remain in position of full extension. The locking occurs as a result of medial rotation of the femur during last stage of extension. Locking is produced by the quadriceps femoris. So, locking a muscle ke, which one is the locking muscle?
Quadriceps femoris.
Quadriceps femoris, yes. The unlocking occurs as a result of lateral rotation of the femur during initial stage of flexion. The unlocking is produced by the popliteus muscle. And this all about the knee joint. So we read hip joint and knee joint. Now we come into the, before ankle joint, we first tell the tibiofibular joint. How it is formed? Like a radius ulna, like this. In the tibia, there is a fibular facet in the lateral condyle, posterior part of the lateral condyle. There is a fibular facet. The head of the fibula is articulate here, and the lower end of the fibula articulate with the fibular notch of the tibia. So articular part is the upper head of the fibula with the fibular facet of the tibia, and the lower part of the fibula with the fibular notch of the tibia. There are 3 joints: superior, inferior, and medial tibiofibular joint. The superior tibiofibular joint is the plain type of synovial joint. Okay? In the superior tibiofibular joint is the plain type of synovial joint, and the middle and the inferior tibiofibular joint is the syndesmosis variety of the fibrous joint. So what are the other type of fibrous joint? Can you tell?
Medial radioulnar joint.
Other type of fibrous joint. Fibrous, not the example of the fibrous joint. I tell the other type of fibrous joint. You read the classic.
Suture and composite.
Yes, suture and gomphosis. One is the syndesmosis, one is the suture, and one is the gomphosis. So these two, first I tell the superior and middle and inferior. These two are the syndesmosis type of synovial joint. In between tibia fibula, there is the interosseous membrane. So interosseous membrane, all the interosseous membrane are joints is like syndesmosis type of fibrous joint. The ankle joint. Now we come into the ankle. Ankle joint is surrounded by medial malleolus, lateral malleolus, like this way. All the student hold your bone and from the joint. When you read, then you form joint with bones, because during professional exam, the examiner tell you the formation of the joint. So this is the ankle joint by the lower end of the tibia, lower end of the fibula, and the talus. So it is the hinge type of synovial joint. Hinge type of synovial joint. If it is hinge, so it is in according to axis. Which axial joint it is? Can you tell?
Ma'am,
Uniaxial.
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 Yes, uniaxial. Here movement occur in one axis. So this axis is the in the ankle. The movement is the dorsiflexion and the plantar flexion, because this surface is called the dorsal surface. This surface is called the plantar surface. So when dorsal surface is close to the other surface of the body, this is the dorsiflexion, and when this movement occurs, is called the plantar flexion. There is no flexion and extension, only the dorsiflexion and plantar flexion. So articular surface. The upper articular surface is formed by the lower end of the tibia, including the medial malleolus, the lateral malleolus of the fibula. So if you see this figure, and the lower part is formed by the talus, the articular area of the upper, middle, and the lateral aspect of the talus. See the figure. This one is the ankle joint. This one is the talus. This one is the fibula. This one is the tibia. This is the lateral view. This is the anterior view. This one is the talus. This one is the tibia. This one is the fibula. Okay. So this complete up to the ankle joint, but some other joint also present the articulated foot. You see these bones. I already mentioned the name of the bones. So this one is the calcaneus, this one is the talus. So this joint in between these two bones is called the talocalcaneal joint. Talocalcaneal joint. This is the plain variety of synovial joint. And this informed bones is the navicular. Talocalcaneonavicular. Here is a joint also occur. This is the restricted type of ball and socket type of joint. Restricted variety of ball and socket type of synovial joint. So talocalcaneonavicular joint is ball and socket type of joint. And this talocalcaneal joint and talocalcaneonavicular joint, there is movement occur. This one is the inversion and eversion. Okay, this movement is the inversion and eversion. It is very, very important. When the plantar surface is faces medially, is called the inversion, and also the medial border of the articulated foot is upwards. This movement is called the inversion. When plantar surface is faces laterally, the lateral border of the articulated foot is faces directed upwards, is called the eversion. Okay, inversion and eversion. You must show the inversion and eversion. Inversion is caused by the tibialis anterior and tibialis posterior, and eversion is caused by the peroneus longus and peroneus tertius. You read from read the joints from your book in the if you read the BD, the joint chapter is last of the inferior extremity. So you read from this portion. Okay. So what is inversion? When the plantar surface faces medially and the upper medial border of the foot is upwards, is called the inversion. The line category, if cut the line, you join again in this ID. So inversion muscle কি বলছি? tibialis anterior and tibialis posterior, and eversion peroneus longus and peroneus brevis. Okay. So this other, the cuneiform, in between three cuneiform, these are the plain type of synovial joint, and also the roll 88 join করেছো? ওকে, পার্সেন্টেজ কি তুমি নিয়েছিলে রোল 88?
Yes, ma'am. নিয়েছিলাম।
আচ্ছা, ঠিক আছে।
Yes, ma'am. নিয়েছিলাম, ma'am.
আচ্ছা, তাহলে আমরা বলছিলাম কোনটা? 3 cuneiform, এই যে তিনটা cuneiform, middle cuneiform, তারপরে intermediate cuneiform and the lateral cuneiform. Intercuneiform joint is also the plain variety of synovial joint. Tarso-metatarsal joint is a plain variety of synovial joint, but metatarsopharyngeal joint is condylar type of synovial joint. Condylar type or condylar variety of synovial joint. Interpharyngeal joint is Hinge type of synovial joint. So you must read the joint name and joint type.
Okay, ma'am.
Okay, and you can ask any question from this lecture. Any problem? This all about the bones and joint of the infraction. তোমাদের কারো কোনো কোশ্চেন আছে? আচ্ছা, কারো কোনো কোশ্চেন না থাকলে আমি ক্লাস শেষ করছি। ইনশাআল্লাহ আগামী ক্লাসে আবার তোমাদের সাথে দেখা হবে। এর মধ্যে তোমরা বোনস, হ্যাঁ বলো।
ম্যাম আসসালামু আলাইকুম। ম্যাম ক্লাসের বাইরে একটা কথা বলতে চাচ্ছি।
ক্লাসের বাইরে মানে কি?
ম্যাম টিউটোরিয়াল ক্লাস নিয়ে ম্যাম।
হ্যাঁ বলো, টিউটোরিয়াল ক্লাস নিয়ে।
ম্যাম আমরা তো টিউটোরিয়াল ক্লাস ম্যাম 2 ঘন্টা করছি ম্যাম, অনেক কিছু বুঝতে পারতেছি না ম্যাম। স্যারের কথা কিছুই বুঝতে পারছি না, বলতে গেলে 50%ই মানে একদম শুনতেই পাচ্ছি না, এরকম সমস্যা। ম্যাম এখন
তুমি কোন ব্যাচ বাবা?
ম্যাম এ আর ডি।
এ আর ডি ক্লাস নিচ্ছে কে?
মঞ্জুরুল
স্যার।
স্যার।
আচ্ছা, ক্লাস শুনতে পাচ্ছ না মানে কি তোমাদের নেটওয়ার্কের সমস্যা হচ্ছে?
জি ম্যাম অনেক সমস্যা, প্লাস ম্যাম বাইরের সব শব্দ শোনা যায় বাট স্যারের কথাই বোঝা যায় না ঠিকভাবে।
স্যারের
ম্যাম
কথা
সেম
বুঝে
প্রবলেম আমাদেরও বি
বি ব্যাচ আসো কার কাছে? সুমিত স্যার,
প্রিন্স স্যারের
ম্যাম
কাছে।
অনলাইনে অনেক সমস্যা হয়, বোঝা
প্রিন্স
যায় না।
স্যারের কাছে। তোমরা স্যারদের ভয়েস পাচ্ছ না, কিন্তু সারাউন্ডিং
ম্যাম
সাউন্ড পাচ্ছ।
সারাউন্ডিংস ভয়েসটা বেশি আসে স্যারদের ভয়েস থেকে।
আচ্ছা, আমি খেয়াল করিনি, আমি যদি ওদের ক্লাসের সময় ওদিকে গেছি, কিন্তু আমি খেয়াল করিনি ওরা হেডফোনে ছিল কিনা। এটা হতে পারে হেডফোন না ইউজ করলে এই সমস্যাটা হতে পারে। আমি তাহলে ওদেরকে বলবো হেডফোন ইউজ করতে।
না ম্যাম হেডফোন
আর
ছিল।
হেডফোনটায় কোনো সমস্যা ছিল?
জি ম্যাম।
আমি ক্লাসের সময় তোমাদের কোনো
জি
সমস্যা
ম্যাম
হয়েছে? সেম প্রবলেম?
না ম্যাম, আপনার কথা
না
কোনো
ম্যাম।
সমস্যা হয় না।
এই প্রবলেম হয় নাই। আচ্ছা, যারা টিউটোরিয়াল ক্লাসের টাইমে আমার সাথে ক্লাস করো, এই ব্যাচ
না ম্যাম আমাদেরও
তারা,
সমস্যা হয়।
তাদের কি এরকম সমস্যা
না
হয়?
ম্যাম, আমাদের সমস্যা নেই।
ও ম্যাম আমাদের সমস্যা
ম্যাম।
হয় না।
ম্যাম আমরা অনেক ভালো করে বুঝতে পারি।
আচ্ছা, তাহলে হয়তোবা বসার জায়গা, কিন্তু তোমাদের প্রিন্স স্যার যেখানে বসেছিল ওখানে তো সারাউন্ডিং সাউন্ড তেমন ছিল না। মঞ্জুর স্যার অবশ্য আজকে ক্লাস টাইমে মাঝখান থেকে একবার চেঞ্জ করতে হয়েছে বসার জায়গা, হয়তোবা এই কারণে একটু সমস্যা হতে পারে। তারপরে আমি দেখবো ওদের হেডফোন নিয়ে কোনো সমস্যা হচ্ছে কিনা, আমি ওইটা আগে চেক করতে হবে।
ম্যাম
কারণ
তবে
তুমি যদি
আমাদের
সারাউন্ডিং
এভাবে
সাউন্ড
বোঝার
পাও
জন্য
তাহলে
একটু
তো স্যারের
অসুবিধা
সাউন্ড না
হয়।
পাওয়ার কথা না।
ম্যাম আমাদের যদি অফলাইন ক্লাসে ব্যবস্থা করা যেত, শুধু টিউটোরিয়াল ক্লাসগুলো, অন্তত অ্যানাটমিতে আমরা বোনগুলো ম্যাম ভালোভাবে বুঝতে পারি না।
টিউটোরিয়াল ক্লাসগুলো আসলে আমরা অফলাইন কিভাবে করবো বলো? এটা তো সরকারি নির্দেশনাতেই অনলাইন হয়ে গেছে। এখন যদি একবার নোটিশ এরকম হচ্ছিল যে তোমাদের লেকচার ক্লাসগুলো শুধুমাত্র অনলাইনে থাকবে, বাকি ক্লাসগুলো অফলাইনে, টিউটোরিয়াল ক্লাসগুলো ছোট ছোট গ্রুপে অফলাইনে করা হবে, কিন্তু পরবর্তীতে তো এই নোটিশটা আবার চেঞ্জ হয়েছে।
ম্যাম অনেক মেডিকেলে তো
ম্যাম অনেক মেডিকেলই তো অ্যানাটমি ফিজিক্যালি হচ্ছে ম্যাম।
এখন বাবা এভাবে করে তো আমি অ্যাকচুয়ালি এই বিষয়টাতে কিছুই বলতে পারবো না। তোমরা প্রতিষ্ঠানে তোমরা একটু যোগাযোগ করে, মানে অফিসিয়ালি যোগাযোগ করে বিষয়টা দেখতে পারো। যদি তারা নির্দেশনা দেয় যে অফলাইন ক্লাসের জন্য, তাহলে তো অবশ্যই
মেডিকেলে তো ম্যাম
offline class
অফলাইনে
হবে।
ক্লাস চলতেছে।
ম্যাম আপনি
East
যদি
West?
একটু রিতা
আচ্ছা বলো,
ম্যামকে
আমি
বলতেন।
একটু শুনে রাখি। বলো, আমি ম্যাডামের সাথে কথা বলবো। ম্যাডাম তো অ্যাকচুয়ালি পরীক্ষা নেওয়ার জন্য এখন ব্যস্ত। তোমাদের প্রফেশনাল পরীক্ষা চলতেছে 25তম ব্যাচের। তো ভাই 5টা মিনিট পরে করলে হতো না? 5টা মিনিট নাকি লোক করবে? আচ্ছা আচ্ছা, তাহলে তোমরা একটু শর্টে কথা শেষ করো। আমার এখানে ওই কাজ করতেছে, দেখি শব্দ এখন বেশি হয়ে যাবে। আচ্ছা, তোমাদের ইস্ট ওয়েস্টে এখন অফলাইন হচ্ছে, ইস্ট ওয়েস্ট আর
ইউনিভার্সাল অনলাইন হচ্ছে, অফলাইন হচ্ছে ম্যাম।
আর কোথায়?
ইউনিভার্সাল মেডিকেল কলেজ।
ইউনিভার্সাল আর
ম্যাম
এনামে কি অনলাইন নাকি অফলাইন?
অফলাইন হচ্ছে।
অফলাইন। তোমরা এগুলো কি নিজেরা কনফার্ম তো নাকি আমি বলবো পরে আবার চেক করবে না? তোমাদের নিজেদের ফ্রেন্ডরা আছে ওখানে?
জি ম্যাম, ফ্রেন্ড আছে।
জি ম্যাম।
আচ্ছা, তাহলে আমি ম্যাডামের সাথে কথা বলবো, কিন্তু তাহলে ওরা লেকচার ক্লাসগুলো কিভাবে করতেছে?
ম্যাম লেকচার ক্লাস অনলাইনে করছে।
কিন্তু একই টাইমে আমাদের তো, যেমন ধরো এই যে আমি যেমন কন্টিনিউয়াস তোমাদের টিউটোরিয়াল নিয়ে লেকচার শুরু করলাম, এখন যদি এমন হইতো যে টিউটোরিয়াল ক্লাসটা অফলাইনে, তুমি কলেজে ক্লাস করলে, তাহলে তুমি লেকচার ক্লাস অনলাইনে ওই টাইমের মধ্যে কিভাবে জয়েন করবে?
ম্যাডাম এই ক্ষেত্রে হচ্ছে যে দুইটা টিউটোরিয়াল ক্লাস যদি আমরা
একটু জোরে রোল 2 কথা বলছো, আমি শুনতে পাচ্ছি না।
ম্যাম এই ক্ষেত্রে যদি আমরা দুইটা টিউটোরিয়াল ক্লাস একসাথে করি, মাঝখানে আধা ঘন্টার একটা গ্যাপ দেওয়া হয়, তখন আমরা বাসায় যাই লেকচার ক্লাসটা জয়েন করতে পারবো।
আচ্ছা, বুঝতে পারছি। তাহলে রুটিনে চেঞ্জ করতে হবে আমাদের।
জি ম্যাম।
2:30 পর্যন্ত অফিস টাইমে থাকবে, মানে কলেজ টাইম 2:30 পর্যন্তই, বাট লেকচার ক্লাসগুলো সব একদিকে চলে যাবে আর টিউটোরিয়াল ক্লাসগুলো সব একদিকে।
জি ম্যাম।
এটা ভালো
জি ম্যাম।
ভালো হয়।
বুঝতে পারছি। আচ্ছা ঠিক আছে, আমি আজকে তাহলে রিতা ম্যাডামের সাথে কথা বলবো। তোমরা এর মধ্যে যেভাবে ক্লাস করতেছো সেভাবে করো, হ্যাঁ? ওকে, ক্লাস টাইম শেষ, তোমাদের ব্রেক টাইম, তোমরা ফ্রেশ হয়ে আবার পরবর্তী ক্লাস যেটা আছে ক্লাসের জন্য বসো। আর এর মধ্যে তোমরা পড়াশোনা করবে, যেভাবে হোক না কেন, অনলাইন হোক অফলাইন হোক, যেভাবে চলছে তোমরা পড়াশোনা করতে হবে।
জি ম্যাম।
ইনশাআল্লাহ পরের ক্লাস আবার দেখা হবে।
আসসালামু আলাইকুম ম্যাম।
ওয়ালাইকুম আসসালাম। আর রোলে কি এটা আমাকে পার্সেন্টেজটা পাঠিয়ে দিবে?
Yes, ma'am.